I know.
Sorry.
Hi. All right, guys. Some of you come on the mat just so you can hear.
Okay. I don't have a problem with
Yeah. All right. Everybody here?
Yeah.
All right. So, which transfer did you just do?
Hop over.
So a sliding board is similar to a hop over, except for the fact that you're using a board. But a lot of the same principles they're kind of connected. So first thing for transfers, I'm sure they went over it in the other group, but you want to make sure that.
But for somebody that's not necessarily in front of 12 but just has trouble standing up completely, it might be the same. But so that you get the real idea of that, we're gonna do more of that spine wheelchair transfer.
Yeah, this is.
The other wheelchair, the leg rests are permanent. They don't come off.
Yes. Okay.
There's one in the middle.
99% of wheelchairs, the leg rests come off, and you want to get them out of your way whenever you can. So when you're coming in to do your transfer, what are you first saying to them?
Hi, my name is.
Okay. Hi, my name is Denise. I'm your OT today. Do you know what OT is? No. Okay. So we work on your ability to get yourself on and off the toilet and out of the shower, get yourself dressed. So today I want to get you from the wheelchair into the bed. So what I'm going to do, my patient, come on up. Come be my patient. All right. So I want to make sure the wheelchair is close to the mat or the bed, whatever this is. If it's too far away, it's unsafe, and you will not do well in the practical if you set it up this way. So you want to make sure it's directly. It's parallel. I mean, you could do it a little tilt. I usually, for the sliding board, have it as close as you can. Okay. You want to make sure brakes are locked. And then these leg rests come off. So we're going to use that to our advantage. For your safety and the patient's, you take the leg rests off.
How do you even take that off?
So every leg rest is different, but most of them have a little lever that you push down, slide out, and lift up.
Okay.
Okay. This armrest is a flip back armrest. So this you flip up and slide back.
So it has to be tight enough.
Okay. Some armrests you just push a button and pull out. Depends. So brakes locked, legs rest off, arm rest back. So now I'm going to put the gate belt on.
Like this, and then you grip the pants as well, so you can cover. Okay. So we're going to do a massive transfer.
And this gate belt isn't that big, so I've been folding it.
Transfer would look something like this, where the patient's here. You're just
Wrapping around, so you want to have the one finger, but you don't want it to be too loose, okay? Feels snug. So, first thing you want to do is explain to your patient what you're doing, so that they can help when they're able to, and so that they're not nervous, not knowing what's going on. Okay, so the first thing we're going to do is practice going from the wheelchair to the bed. I'm going to use a sliding board since you're having trouble standing up, and we're going to sit and slide on the board into the bed. We're going to go over 3 different transfers. We're going to do supervision, min assist, and max assist. All right. Supervision is FIM level what? What number?
5.
5. Min assist is.
Isn't that a 2?
Min assist is.
2. Min assist.
Nope.
4.
No,
4?
4. Min assist is 4.
Oh.
Max assist is what? 2. Okay. So we're not going over mod assist just because I want you to get a good concept between min assist and max assist. Mod assist is in between, so sometimes it's hard to see the difference unless it's actually a patient. So supervision is 5, min assist is 4, and max assist is 2. So first I'm going to do a supervision transfer. Supervision, no hands-on assistance. You're just setting up the transfer and providing verbal cues. Alright, so I'm going to ask that you lean over to your left side, and if you lift up your leg, I'm going to place this board right here. Okay, so when you're placing the sliding board, if I can get my hand in, you want to make sure that it is underneath the patient's thigh. You don't want it underneath their butt, because if they're doing the transfer and they slide, there's not a lot of surface area. So you want to have it right underneath the thigh so that there's room for them to slide a little bit. You also want to make sure that enough of the board is on the wheelchair as well as the bed. So as you can see, She's not gonna, this is okay.
Wrap
And if
my
you just
arm
lift up
around
this
her.
leg, you can see that it's all on the wheelchair, okay?
So from here,
Alright,
now I'm
so
looking at
supervision,
the
I'm just
distance
giving her cues
between
on what to do.
her
She's never gotten
and
out
the
of the bed,
wheelchair.
out of the
So I like
wheelchair using a sliding board, so this is her first time, so we're
Okay.
giving her feedback.
Two things.
So what I want you to do is take your right hand and press firmly on the board. You don't want to tell your patients to grab it, because when they transfer, it will squish their fingers. So palm flat on the board. You're going to take your left hand and you're going to push
Or
off
you
the
can
wheelchair.
just.
And I want you to do gentle slides
And
across
what
the
you're
board.
gonna say is,
Okay?
okay, someone asked, like, you ask the patient to
Keep going. Now take this hand and push it here so you can hold onto the board and keep sliding
But I
over.
tell them what I'm gonna do.
Beautiful. Okay.
Okay.
Great. Everyone see how that was supervision? I set up the board for her and then I gave her cues. I did not have to physically assist her or lay my hand on her to provide her assistance during the actual
What we're
transfer.
gonna do is
Okay.
we're gonna just pop over into the wheelchair.
To go backwards,
What I'm gonna have
same
you do
thing.
when I'm
Lift up
ready,
your leg for me. I'm going to
take
place
your
the board.
hand and you're gonna
Okay.
reach for this.
Now I want you to
for
take
the
that
frame,
hand,
Okay? And what
take
I
your
want
right
you to
hand
do
and
is as
push
I
you
try
can,
to
push it
pull
on the
you,
board.
or pop you
And I'm
over,
nice and close.
you're
Downhill that time.
but you hear my directions.
All right, any questions about that one? All right. One of the other classes was, the other group was asking, why would you use a sliding board versus just like a pop over like you guys did? Some people feel like it's kind of in the way. Some of the main diagnoses that we use sliding boards with is like a neurological diagnosis, so a spinal cord. Right now I have a C5 and a C6, and we go through sliding boards with them because they're able to kind of prop their
What I'm
hand and
gonna
scoot
do
along.
is, I don't like how
Whereas
far
they're not
apart
strong
your
enough
legs are,
necessarily to
because
do
it makes me
that
feel
whole
too far away
one
from the
scoop
wheelchair.
transfer that you would have to do, that you were just doing over there.
Closer.
Sometimes if someone is non-weight bearing on both legs, if they're non-weight bearing, you can't put their feet on the ground to do a pop
I
over.
have my thumbs
So you would need to use a
so,
sliding
and
board,
I have her
okay?
hands. Sorry, Ann. Okay? And what I'm
Sometimes you can
gonna do
progress
is
off of a
I'm
sliding
gonna
board
lean
to
into
a
it.
pop over
Okay,
or
goes
scoop.
over toes.
What is she calling it?
Because
A pop over, instead to a pop over. But sliding board sometimes is a precursor to that, so it's more of, sometimes a lower level transfer.
If you use that along with
And
the
also the
body
thing with the sliding board is that it
then
can
you will
help,
succeed.
the patient can help a little bit more sometimes. Like the other day I had an amputee who didn't have the strength to stand up or pivot, but when she used a sliding board,